Today we're going to be doing a head and neck assessment on my patient Ryan. So we're going to start with inspection. We're going to inspect his head and neck to make sure everything's, the size is good and the symmetry is normal. So I'm going to take a look at his head and neck. Yeah, everything looks good. So he's pretty symmetrical. Sizes and all of his body and head are a good size. Next, we're going to look at his hair color, and we're going to look into his scalp and make sure that the texture and the distribution is normal. Make sure there's no lesions or any other critters in there. So, alright, and everything seems normal. His hair is a good texture, the distribution is normal. Next, we're going to look at the symmetry of the face. So we're going to look at his ears and we're going to make sure that they're symmetrical. His top of his ears should be right aligned with the outer campus of his eye, or like the outer corner. So it looks like his ears are a little bit high up on his head, but that doesn't mean anything's wrong. He's probably fine. And then next we're going to look at the nasolabial folds, which are, like, in other words, the smile lines. We're going to make sure those are symmetrical. So it looks like his smile lines have symmetry. Then we're going to look at his palpebral fissures, which are just the lines in your eyelids. And so I'm going to have him close his eyes. Close your eyes for me. It looks good. Alright, and then we're going to move on to cranial nerve 5, which is the trigeminal nerve. So I'm going to touch his face and make sure that he can feel the sensation on both sides equally. So, do you feel me touching your face? Alright, and do you feel it on this side?
Yes.
And this side? Alright, all is good there. Move this over so you can see me better. Then we're going to check for palpation of the temporal muscle. So with both hands, I'm going to feel the muscle right above his jaw, which is a really strong muscle, and I'm going to have him bite down and clench it. So go ahead and do that for me. And this is a really strong muscle, so you'll be able to feel it really well. All right, and that's the temporal muscle. And then we're going to move on to cranial nerve 7, which is the facial nerve. And I'm going to have him do different facial expressions to make sure that his cranial nerve 7 is all intact and in good condition. So go ahead and smile big for me. All right, and you can see that it's an even smile on both sides, and the corners meet like right in a line with each other. Go ahead and puff out your cheeks. Okay, looks good. Grit your teeth for me. Okay. And then raise your eyebrows. Alright, everything looks symmetrical there. Now squeeze your eyes really tight. Okay. His cranial nerve 7 seems to be working well. Alright, and then we're going to do palpation next. So we're going to palpate with either our 3 fingertips or 2, and we're just going to move in slow circles to feel for the lymph nodes. So I'm going to use my 3 fingers, and we're going to start with the preauricular lymph nodes. So those are going to be like so right in front of the ears. So I'm just going to move in small circles, and feel for those. And those are really small, so you won't be able to feel much. And then we're going to move on to the postauricular lymph nodes. So those are right behind the ear, and those are small as well. Next, we're going to go to the occipital lymph nodes, which is right behind the head. So it'll be directly behind and kind of on below on the bottom, right above the neck. Alright, and then we're going to move to tonsillar lymph nodes. Those are right below the angle of the jaw and the neck. So they should be easily movable. There shouldn't be any fixation or hard nodules. So that feels good, and I can really feel those. And then we're going to go on to the submandibular lymph nodes. Those are directly below the jaw, so those are going to be right here. And then we're going to go to the submental lymph nodes. And this is one where you use one finger to feel for them. So you're going to go right below the chin, underneath the jaw kind of, and you're just going to go in a small circle with one finger. And then we're going to go to the, okay, and then we're going to check the sternocleidomastoid muscle, which is in the deep cervical chain. So the deep cervical chain is like this big muscle right here. And we want to check and move the muscle side to side for the lymph nodes. So I'm gonna start on his right side and kind of push to the right and feel that muscle. And then I'm gonna come to his other side and feel it. All right. And then, which that is the deep cervical chain. And next we're going to go to the supraficial cervical chain, which is in front of the deep cervical chain. So we're just going to kind of move in front of the deep cervical chain and feel right there. And then we're going to go to the posterior cervical chain. So that's going to be behind the deep cervical chain. So, wait, right? Oh no, I'm sorry. The posterior cervical chain is close to the traps. So that's going to be like right slightly above the traps. And then we're going to move on to the supraclavicular lymph nodes. So those are like, you're just kind of hook your fingers right above the clavicle and feel for those. So I can feel those. Okay, and then next we're going to move on to the trachea. So we're just going to make sure that the trachea, it should be in line. It should be right on the midline of the neck. Now I'm assessing the thyroid cartilage. So the thyroid cartilage is going to be right above the Adam's apple, right here. So I'm going to go ahead and feel for that. There's the Adam's apple. There's the thyroid cartilage. And then next I'm going to assess the cricoid cartilage, which is right below the Adam's apple. So you should be able to feel like a small hole right there. And then I'm going to assess the thyroid. So I'm going to start on the right side. And I'm going to stand behind Ryan. And I'm going to slightly, softly push the thyroid to the right. And I'm going to ask him to swallow. So go ahead and swallow for me. Okay. And there shouldn't be any, it should be easily movable. Now go ahead and swallow for me again. Okay. Everything feels good. Alright, next we're going to move on to cranial nerve 11, which is the spinal accessory nerve. It's just a part of the motor nerve. No sensations for this one. So I'm going to push down on my patient's shoulders, and he's going to shrug his shoulders, and they should be easy to move. Okay, shrug a little harder. Okay, and that's just checking the strength of the trapezius muscles to make sure that they're working well. Alright, and then lastly, we're going to check the sternocleidomastoid muscle. I'm going to check the resistance of we're just checking like the deep cervical chain's muscle strength and making sure that it's working properly. So I'm going to check the resistance. I'm going to put my hands on his jaw. I'm going to have him push against the way that my hand is pushing. So we're going to start with this hand. So go ahead and push against it. Okay, now do the other way. Alright, and all that seems to work well. So that was his cranial nerve 11. And I guess that's it. Thank you.